I was involved in a symposium on sex and sports, caring for the female athlete, ACL injuries. Soon this will be published in the Journal of the American Academy of Orthopaedic Surgeons. We also had a poster on sex-based considerations in caring for common sports injuries. This was sponsored by the Women's Health Issues Advisory Board, which I have been a member of. WEAB seeks to advocate, advance, and serve as a resource on sex and gender differences in musculoskeletal health. I would suggest that you go to that website if you're interested or take care of female athletes and want to know more about the unique sex differences that occur in active females and female athletes. In my part of this symposium and the poster, ACL Injuries and Management, Epidemiology, we still see differences where females tear their ACLs more than males, particularly in basketball and team handball, which is more of a sport in Europe. As far as prevention and post-ACL rehab, there's no sex differences in the literature. The mechanisms of injury are very similar. When we look at intrinsic risk factors or risk factors that can't be changed, there are no significant differences, but there are some differences that we will be looking at in the future, such as tibial plateau geometry, the slope of the tibial plateau, the size of the tibial plateau, and also the femoral condyles. South African researchers have identified a COL5A1 gene that's associated with increased risk of ACL injuries in females. We'll see more work about these genotypic changes in the future. Fortunately, there is no hard evidence that hormonal influences or joint laxity is a risk factor. Certainly there are risk factors that are extrinsic, or these are ones that we can change. The female has more valgus at the knee, and there is a valgus collapse and rotation of the femur that puts the female knee in a more at-risk position for ACL injuries. We've done a lot of research on mini squats, position. The diagram in the middle there is of a normal male and female. You can see a difference where on the side view or the sagittal view with them doing mini squats, you can see her pelvis is anteriorly rotated, her body is forward, and then on the left, that drives the hip into internal rotation, adduction, knee into valgus, and in order to stay upright, the foot is externally rotated and pronated, and the tibia is externally rotated, and this is getting into this position of no return. As far as surgical management, graft choice, no sex differences, don't change based on cosmesis. A female ACL needs stability, and the best in 2016 way to get that stability in a college or younger individual, skeletally mature, is bone patellar tendon bone autograft. Hamstrings is another consideration. Allograft. In that age group, there is a significant increase in re-injury based on Moon studies. Graft failure, future surgeries. This meta-analysis is a good one for reference. Return to play, males versus females in the Moon study. Only 30% were still playing, 7-year follow-up. Females were more likely to have ACL surgery. Older athletes and females were less likely to return to play, so there were some outcome differences in this Moon study, which is a multi-center study of orthopedists in private practice and university settings. We need a registry. In the Swedish registry, 84 female soccer athletes, 12-year follow-up, 42% had symptomatic knee osteoarthritis. That is a very shocking high rate of osteoarthritis, and this is regardless of if they had an ACL reconstruction or not. So there was no difference in the arthritis if they underwent an ACL reconstruction compared to those who did not in this Swedish registry. Again, a little smaller country, but 84 female soccer athletes. 75% affected their quality of life by this knee osteoarthritis. We've got to do better. We've got to have follow-up, and we have to counsel patients who are developing arthritis of changes of cardiovascular fitness, less impact, and follow them more closely. Thank you for your attention. This is my website where this and other videos are posted. So please visit this, and I hope this helps you.